We're talking tonight with Dr. John Mancoll. He is a board-certified plastic surgeon. 969-2720 or 866-969-2720. Talking not only about skin reduction after weight loss, but some other things. Dr. Mancoll is also the medical director at the Burn Center of St. Joseph Medical Center. We'll talk a little bit about that in just a second. Let's show some before and afters here, and we'll kind of give you an idea of what is possible. And we'll start out with a young woman. And can you tell us her story?
This is kind of a typical patient, maybe not the super weight loss, but just someone who's been heavier at one point in their life, whether through pregnancy or just simply decided they were going to lose weight. And we see there on the left the pre-op picture where we see a little pooch of the belly. It's kind of round, a little overhang of skin, that pannus we were talking about a few minutes ago. And then on the right we see post-op after tightening the muscle layer, the fascia around it, the skin, a little bit of liposuction maybe on the edges for contouring. And this is the side view. And then here's the front view, and again on the left you can see sort of that loose, relaxed skin look. Some stretch marks might be there, and this is very typical of our massive weight loss patient, where that skin just hangs off of them. And sometimes you can take out what seems like, you know, a foot or two of extra skin when you really get it all loosened up.
Yeah, did you reposition the navel on this patient? Do you remember?
You have to, almost by definition. Some of these folks, actually, we end up taking their belly button off and making them new ones if there's so much laxity. The umbilicus is as much like a flap as any other piece of skin, and sometimes it's safer and easier just to make them a new one.
Fascinating. Let's go to the next graphic if we have one here for us. Take a look at this patient. Oh, that's the same one.
This is just the kind of the other view of the same thing here.
Okay. So. Are you encouraging people to think about this procedure? You said when you're about halfway through is a good time?
Well, what I find is I think they need to keep in mind their endpoints for anything they choose to do from a medical standpoint, and with a goal. And a lot of times part of the goals these patients have is to feel better in their own body, and with that comes these kind of surgeries. If we see folks sort of during the process, we can kind of, again, encourage them. There's not a lot I'm going to tell them to do beyond what their general medical doctor may be telling them, as far as good nutrition is important, and that should be part of a good weight loss program. Exercising, maximizing their heart and their lungs type of thing. But a lot of times, again, like I said, they just sort of need that extra encouragement to know, what's my goal here? What am I doing this? You know, where do I see myself when it's over? Some folks have no idea what they can expect. A lot of them are internet savvy, so they're sort of seeing some things. I think some of the reality medical shows have certainly given folks a glimpse of things, and sometimes an unrealistic glimpse of things, because you only see the best candidates on those shows. You don't see a lot of what I would call my typical patients showing up in 8 weeks being ready to go back to all their normal activities with massive weight loss. So those shows do create a bit of an aura that we have to dispel and bring them back down to reality of what we truly can do.
Will you typically do all the areas at one time, or are you going to, as they do, you just mentioned those reality shows, Extreme Makeover, always, gosh, what a torture to put yourself through, where I'm having skin removed on my arms, my legs, my chest, everywhere. Will you do it all at once?
No, typically it's staged. I do believe that we should probably limit to no more than 8 hours of operative time, and there's only so much you can achieve in 8 hours, although we can do a lot. We'll usually break down the abdomen and the buttock area into one operation, maybe the outer thighs, and then a second operation, look at the arms and breast, for example, in one, or inner thigh. So we do tend to stage those, and some folks are working with me for over 2 years, kind of start to finish, depending on how many areas we're trying to address.
There are a lot of younger people who are having bariatric surgery these days, and coming in and having that procedure done, and their weight is not always stable. So let's assume that I've lost that weight, and then some years later I regain that weight. The fact that I've had that skin removed, what kind of problems is that going to cause?
I wish it created more problems, because maybe they wouldn't put the weight back on, but the fact is the skin will grow again. It's got the property and the inherent ability to stretch if put under that influence. I do think that unfortunately the studies are showing that there is a percentage, as much as a third, that may eat right back up to their weight. They may get down, and then they haven't sort of totally bought into the change of lifestyle, and next thing you know, they're kind of eating what they shouldn't eat, or, you know, there's a lot of calories in a milkshake, and they have a couple of those a day, and you can put on 3,000 to 4,000 calories a day just with liquids if you pick the wrong ones. So if they haven't changed psychologically, how and why they eat, then they're going to, I mean, they're truly going to fail the process. And we sometimes can sort of identify that for them and with them, and try and, again, kind of get them back on track.
I want to shift the conversation now. Dr. Mancoll, as I mentioned just a moment ago, is also the medical director at the St. Joe Hospital Burn Unit, one of 2 burn centers in the U.S. And you're
in Indiana.
In Indiana, I'm sorry. Yeah, more than that in the country, of course. And you're undergoing a significant expansion. Tell us a little bit about that.
Well, we've kind of outgrown our space in the sense that we have a 10-bed unit, of which 9 are used on a regular basis. We have a double occupancy room if there's more than one person in a family. But more importantly, our outpatient clinic really needs some updating and needs to grow. We have too many outpatients for that small space. Additionally, we're seeing more and more wound patients that are coming in for surgical management of their wounds. So it made sense to sort of combine the wound and burn center at St. Joe and under one roof, so to speak, to maximize, I think, patient efficiencies, to sort of blend the cultures of medical management with surgical management. And I see it as only a positive step for those patients that need our services.
We, with the 4th of July just around the corner, fireworks injuries comes to mind for me. Do you see an uptick every year?
We're gearing up already. I'm not real happy about how much easier it is to get fireworks in Indiana, because they seem as novelty items, but in fact they're very dangerous. Probably the most dangerous are sparklers. They burn so hot, 800 plus degrees, and they're ones we want to get pictures of the kids holding. But inevitably we'll probably see anywhere from 20 to 30 patients 4th of July and within a week or so after that of fireworks related injuries. And whether they're actually holding the fireworks or just incidental victims of a firework gone astray, we're going to be busy next week.
And you told me that alcohol is almost always involved in these injuries?
There's a big percentage of folks who've been enjoying the day, kind of judgment maybe get a little bit skewed, or just simply their sense of how much they worry about things might become a little less, and next thing you know, they're getting burned.
What, well, let's do a little burn care 101. When do I need to see a doctor for a burn? You said people often try to treat it themselves for a couple of days before they go get help.
It's not uncommon. People, they're a little embarrassed they got injured, just a firework, how could I get hurt like this? So they'll manage it themselves, and either through the pain, a lot of times hands are involved simply because they're holding on to the fireworks, or they're looking at one that didn't go off, and next thing you know, it goes off in a delayed fashion, and we're seeing it on the face. I think really almost anyone that get burned beyond more the size of, let's say, $50 or so, anything that's really pale, probably should seek medical attention. Now, that doesn't mean they necessarily have to come to a center like the burn unit. They can certainly start with their family doctor. What I tell folks is don't slap butter on it. Don't put ice on them, because they tend to feel better with ice, but you can take a wound that may heal on its own, and then you create hypothermia and frostbite with the ice, and now you've compounded the problem. We have criteria for the burn unit. Greater than 10% of the body is criteria to come see us, certainly for admission. I think the age of the patient's important, other medical problems. And there's just some folks who honestly just don't know where to start. And they're welcome to come to the burn center. You don't necessarily need to be referred in. You can self-refer to be seen there. The number for the burn unit you can get out of the phone book. There is an 800 number as well that maybe they can post here down the road for folks that are out of the area, but yet we tend to take care of people all over northeastern Indiana.
What a long and painful recovery process for a serious burn. I've seen some burn care treatment, and it's a horrible thing to undergo.
It can be crippling, unfortunately, and again with these firework injuries, a few particular cases come to mind. Someone holding maybe a dozen or so sparklers to get them all lit, next thing you know you got a big flash, and now you can have a life-changing hand burn. They can have significant functional long-term effects. So don't light a whole bunch at once, one at a time if you're going to do it, and make sure you're arm's length away from people.
What, okay, no ice, no butter. What do I do if I burn myself?
You can just put a cool cloth on it and then come see your doctor. The ERs will be busy seeing more folks than we probably will, because people may stay local. I typically am going to put an antibiotic salve on, Neosporin, bacitracin, something like that. But the key, a lot of times, is getting the dead tissue off, debriding that, pain management, elevation, control swelling, things of that nature.